Namaskar friends, myself Vaidya Akshay Chauhan from Chauhan Ayurveda Hospital, Noida, India, and I welcome all of you in my this Nashya Karma classes. And today I will discuss about the various types of Nashya, what is actually Nashya, purpose of Nashya and the scope of Nasyam. So today we will discuss about this all about Nasyam. So let's start. And today, so the Nasya word and Nasya procedure came from ancient Indian text or ancient Indian medical system or ancient Indian healthcare system. So they used to give some medicines through nose, and they give it term the Nasyam. So later you might be knowing that there is a body detoxification process that is called Panchkarma. So all the acharyas has told that Panchkarma is very much useful for detoxification purpose as well as curing various diseases. So that Nashya is one among that Panchkarma. And the use, some people think that Nashya works only in the Jatrurdh, means that is above the clavicle bone. So some people think that Nashya Karma works only here. But you can understand that all the 5 procedures of Panchkarma, they have made for complete detoxification, and their medication routes are different. Like people thinks that Vamana Karma is for this purpose. No, Vamana Karma is for Kapha dosa. It may be in any part of body. Similarly, Vrechana, people think that that is for abdominal disorders. No, this is for Pitta Karma and this Pitta may be in any part of body. Similarly, Vata, Basti is for Vata, for whole body. It covers whole body to cures Vata disorder. Similarly, Vamana, Vrechana, Basti, Nasyam. Similarly, the Nasya is, it covers whole body, but the route of medicine administration is nose. Similarly, nowadays you might be knowing that some of the countries is making the nasal vaccine for coronavirus or different viruses. So you might be knowing that they today came to know that medicine can be administered through nose also. Initially, people think that medicine only can go inside the body through mouth or through veins or through that anal route, but they are working on that the medicine also can be administered through nose. So that is there now, the terminology nasal vaccine is popular nowadays, and there are many countries are working for nasal vaccine for corona and other diseases. Similarly, that Ayurveda has mentioned thousands years ago that medicine can be administered through nose, and it works on whole body. Yes, of course it works more in this area, but this works on whole body. So similarly, that here you can see that is a Panchkarma, and this is a Vamana, Virechana, Basti, Nasyama, Raktamoksham. There are the 5 most important procedures for detoxification as well as curing purpose. So this is so here that is a Nashya Karma. Nashya Karma is again, we have to again divided in 3 purposes. For what purposes you are going to do this Nashya Karma? Anybody that who want to do Nashya Karma, that they have the target, why they are doing, why, how to do, and these all the things. There are so many things during Nashya Karma. Similarly, here the purpose, Shodhana purpose, means detoxification purpose. So in many conditions like Kapha disorder, in Vata Pradhana disorder as well as in Pitta Pradhana disorder. So here the mainly Sodhana types of Nasyam is applied especially for Kapha and Pitta disorders. Like patient is having heaviness, mild headache. So it means you have to recognize the what that this may be the kafaja dosa pradhan, and so here you have to select the Sodhana variety of Nasyam. So similarly, the other one is Samana. So here just this variety of Nasyam is always maximum useful in Vata Pradhana disorder, not only for head and brain disorders, as well as this is also useful for Vata Pradhana Vyadhi, Vata Pradhana diseases for whole body. Like there are many medicines which is much useful in various Vata disorder around that various neurological disorder, that this variety of Nasya is applied in Vata Pradhana Vyadhi. Similarly, that third variety of Nasyam is used for Tarpana, nourishment purpose. Like in various disorder, like where muscle dystrophy and that tissue degeneration, brain tissue degenerations, Alzheimer's, Parkinson's, there are so many diseases which is always related to the degeneration of the tissues, brain tissues, and here the Tarpana variety of Nasyam is applicable. So here also that every time if doing Nasyam, so the purpose is clear. Either it may be for Sodhana purpose, it may be of Samana purpose, or it may be of Tarpana purpose. Similarly, so there are many varieties of medicines, so which can be used, which can be administered through nose. Like you might be knowing that people are using, sometimes people use that oils. Similarly, sometimes people uses churna. Second variety churna. So similarly, there are four varieties of medicines form has been explained in Ayurveda text, and we are doing in practice. So that one variety is Marsa or Pratimarsa Nasa. Here you hear most of the oil and ghee based medicines. The base is ghee or oil is used for Nasa purpose. Similarly, that second variety of medicine form for Nasya is Avapid Nasya. Avapid Nasyam is here you have to extract some juices from fresh drugs, or you have to collect that kashaya of that decoction of that particular medicine, or you just soaked in water and kept overnight and filtered that liquid properly, and that liquid is used for Nasya purpose. So that all comes in Avapid Nasyam variety. So one is oil based, where you properly processed various medicine in ghee, various medicine in oil, and now that Siddha oil, Siddha ghee you are using for Nasyam. Here the extract or juices from particular drugs. Third variety of form of medicine which administered through nose is Pradhamana Nasya. Pradhamana Nasya means is a churn form. That is the churn variety. This one is Suras variety, and this is Dhum, smoke, or this is the third variety. So second variety is Churna Nasyam. Here there are so many drugs used the powder of that drugs used for nasha purpose. So in there are many drugs which is useful for many different conditions. So and the fourth variety of nasyam is dhuma nasyam, inhalation, like that smoke inhalation. You can understand that the nasyam, that smoking through nose. Yes, now you can understand that smoking through nose, inhaling through nose, and exhaling through mouth. So this is the thing here. Especially we have to note that in here just administering medicine through nose, it may go into your throat, into your stomach, and but it won't come out through mouth. It may, you can spit, but it won't come out through mouth. Here also that whereas you are administering through nose, it won't come out through your nose. You can spit. Third variety, churna. It will be absorbed here in this mucosa, and that this is the super fine powder of particular medicine. And here you have to. The variety is dhumanasya. So that is, you can understand that the nasal smoking. So here you have to inhale dhum. That what is dhum? That is the smoke of particular medicines. Like that is smoking, that cigarette smoking. Here what you do, this is the smoke of tobacco. You inhale through mouth and you exhale through mouth as well as through sometimes through nose. So that is you call that smoking. But in dhumanashyam, what happens? You have to inhale through nose and exhale. You have to throw out that smoke through mouth only. So this is the process of dhumanasya, and this is useful in many conditions. So I think everything is clear. So here the nasyam is a part of panchkarma. Panchkarma is nothing but the detoxification process of whole body, not a particular part. We can target to the particular part, but it works for whole body. So nasyam is here. Here the purpose is clear. For what purpose we are choosing nasyam? That may be sodhana, that may be samana, and that may be tarpana. Here there are the form of medicines which is used for, that is the marsa prati marsa nastha, means oil and ghee based medicines, the liquid sneha medicines. Second variety is avapeda nasa, means extract, that the water based medicine, or you can understand that the juice, decoction, and seed kasaya vatika, hema of a medicine. So this is the variety of avapeda nasyam. Third variety is churna nasyam, just inhaling, just putting that superfine powder here while patient are that inhaling. So inhaling through nose is with a dry powder is called pradhamna nasyam. Fourth variety is dhuma. So this is the four varieties of medicines from. Purpose is clear, sodhana, samana, tarpana, and this is one among the panchkarma. So there are so many medicines, so many indications are explained in Ayurveda text for nasyam. So nasyam, if you are thinking that putting 2 drops of any medicated oil, putting 2 drops of any medicated ghat is only nasyam, no. Yeah, this is the part of nasya, but this is not the whole nasyam. Whole nasya is a big topic. Similar. This is the big similar to Vamana, Vrechal, Vasti, Ratnachana. Here, this just putting 2 drops of medicine is not nasyam. Nasyam that covers whole body. So it targets just like the root is this clear, and it's the action is absorption of different medicines. So here people think, and what the quantity. Sometimes the quantity, how much quantity we can use in this form. Like here the quantity quantity of medicine. If you are going for up to 20 ml, up to 20 ml of oil, ghee or mridu drava, like there are varieties of, like there are so many. One more variety is that is Nasyam, is we have to also discuss, that is called mridu nasya and tiksha nasya. Tiksha nasya means that irritates very much to the nasal mucosa, and it's removes different dosas. So that variety Tiksha Nasyam, Mridu Nasyam, Tiksha Nasyam you can adjust in this Sodhana variety. This is nothing but this is the Sodhana variety of Nasyam, when you have to remove some dosas. So Tiksha Nasya as well as, so here the quantity of medicine, that the oil ghee can be used up to 20 ml quantity. If it is not Tikshna variety, it is not Sodhana variety. So quantity also matters. Swaras also depends on the Tikshanata or Mriduta, like which very hard and strong medicine. So if medicine is hard and strong, then you have to use small quantity. If it is soft or it can be bearable, then you can use more quantity. So similarly here powder always uses in a particular amount. The powder cannot be administered in a large quantity, because this is not a liquid, it cannot flow like any liquid. So here the one pinch of powder will be sufficient, and this is the maximum quantity we can use for Chauhan variety. Dhumanasya, that is that inhaling within both the nose, inhaling through this one and exhaling through mouth. Similarly, inhaling this nostril through this nostril and exhaling through mouth. So this is so quantity also depends on the potency of medicines and everything. So there are many purposes we can use for Dhuma, Pradhamna, Avapida, Mars and Mars Nasyam. So I will give you some examples, like first of all, that you might be knowing that Anutelam. Anutela is that processed oil, and this is that in Ayurveda text they have told that this can be used for regular purpose. So regular purpose means always this is the criteria starts. If you are going for regular purpose, means it may be Tarpana variety, because that there may be, if there is no disorder, you can use regularly for just nourishing parts and keeping all the organs healthy, and keeping the vata disorder or other dosas also in a samana condition, stable condition. So this may be used regular. So Anutela is always beneficial in tissue degeneration also. It helps in brain tissue degeneration disease. It helps in eye disorders, in that nasal disorder. It helps in Vata's disorder, Vata's hair disorder, Vata's that brain disorder. It always helps. So just using regular Anutelam is helpful for that maintaining the maintenance purpose. This maintains everything in Samana condition. It is helpful in many Vata disorder also. Similarly, other one is Brahmi Telam. So Brahmi, the drug Brahmi works for intelligence, dharti smrti, intelligence, grasping power and recalling power. So this is the smrti, means how you can regain, how can you recall. So this Brahmi, if processed with oil, so that oil called Brahmi oil, with some other medicines are also used in, but the main medicine will be the Brahmi, and that oil helps in Dhir Dhriti Smrti, helpful in intelligence, recalling, and smaranam. So this is helpful in many conditions, as well as this is helpful in Alzheimer disease. Yes, it is also helpful little bit in Parkinson disorder. Although that Alzheimer and Parkinson both are Vata Pradhana Vyadhi, but it also, that Brahmi works always on functioning of brain. There are, you can say that the functioning of brain, the tissues is clear, everything is good, but the functioning of brain is altering. In that condition, you have to use the Brahmi. If the tissue related disorder, tissue degeneration started, then you have to use this one, Vacha oil or Anutelam. This is always helpful. So Vacha oil always helpful in stress and depression, insomnia. In that condition, you can use Vacha oil. Til Telam. Similarly, Til Telam is always helpful. This is helpful for Tarpana purpose. The oil works this one, Tarpana purpose, and this is this variety. So oil is, you can use for Tarpana. Vataja headache, that like there are some varieties of headache. That is maybe Vataja headache, Pittaja headache, Kapha headache. So this Til as well as Brahmi oil and Anutelam, these all works very well in Vataja headache. Similarly, yes, we have experienced that there are one more medicine, that one more oil that is called the sarsap oil, mustard oil. That the mustard oil is processed with some medicine. The main thing is the mustard oil, but it is processed, that is what you call Moorchit sarsap oil. So the plain Moorchit sarsap oil used through Nasyam process, and it is helpful for macular degeneration eye disorder. That is a dry variety of macular degeneration. This is one type of eye disorder. So this Sarsap, Moorchit, Sarsap, Tel Nasyam is helpful for macular degeneration of eye, retina or something. So similarly, and one more, yes, you might be knowing that there are one variety of oil that is called Chirbala oil. That is 101, 101, 1001, 101 times processed Chirbala oil, useful for various hair fall disorder, useful in cervical disorder, useful in Bell's palsy, useful in that facial paralysis, useful in migraine, useful in cervical pain. Yes. One more thing, always if you are dealing with oil or ghee based medicines, you have to select the disease. Like if you are having Vata Pradhana disorder, then you are sure that you are going to use either oil, either ghee. So similarly, if patient is having Vata and Pitta Pradhan, so similarly you have to select the medicines. The medicine which works on Vata disorder as well as Pitta disorder. So here that the Chirbala oil, it is very much good for Vata Pitta Pradhana disorder. Like migraine, most of the time if you go for that Ayurvedic correlation of migraine, you will find that this is Vata and Pitta Pradhana disease. So here you can use Chirbala oil. We have experienced in many patients, it gives excellent result. So just putting 10 drops, either you may start with 4 drops in both the nostrils, and later you can go up to 20 drops in each nostril. So initially you start with 4 drops in each nostril. So this is the Chirbala oil helpful in hair fall, facial paralysis, Bell's palsy, migraine, cervical pain, in many disorders. So as well as one more thing that is called Jyotismati tel. Jyotismati oil. Jyotismati is a drug which is highly potential for brain disorders as well as for many Vata Pradhana disorder. So that oil from Jyotismati, so that is good for various brain disorders. It is little bit Tikshna variety, it irritates a little bit, but it gives a very excellent result in Vata Kapha Pradhana disorder. It is hot in potency and it gives excellent result in Vata Kapha Pradhana. So similarly, this is we have discussed about the Mars, Pratimars, and or you can call ghee or oil based medicines in different diseases. Similarly, there are that is called Avapidnasa. This is the second variety. Swaras, when you are putting that liquid or the juice of that particular medicine or decoction of that particular medicine, it is always helpful. So like you can we have experience, there is a medicine what called a G-Mutak. There is medicine G-Mutak. What you have to do, you have to take the root of G-Mutak and you have to mix with just on a stone, just rub on stone with a little bit quantity of water, and if matter that the extract of medicines will come in water, and just after filtering, just you have to put that water in your nose. That is called Nasyam, and especially the drug G-Mutak have a special effect on jaundice, liver disorders, jaundice, and it gives excellent result. Similarly, that one medicine is called Devdali. You have to just soak it in a little quantity of water overnight, and next day just crush it and filter it nicely, and put that medicine water in nose. It starts artificial what you call cold. It stops running nose within 1 to 2 hours. That Devdali hema is just putting in your nose. It starts artificial running nose, and it removes all the kapha and pitta. It is actually it is a Sodhan variety of Nasa, Devdali Nasyam, and it removes kapha and pitta. And we have used many times in pitta's headache. The patient is having a headache, but it is a burning type. So burning type headache, and it also always we have used in that jaundice condition. It gives the excellent result in that condition. Third variety is good ardrak. Just taking some quantity of jaggery, some quantity of fresh ginger, mixing and making that kuttana, and the extract 1 to 2 drops comes out, and just putting that extract in nose. It irritates, but the result is excellent in migraine, as well as patient is having severe abdominal distension. So just you put 2 to 3 drops of this medicine, good ardrak medicine, and it starts belching. And patient get relief in abdominal distension. So this also works in various headache, like Vata Pradhana headache. It works very nicely. Similarly, that is a what you call, you might be knowing, there is a Drona Puspi. There is a medicine what you call a Drona Puspi. Drona Puspi medicine is helpful for snake poison. It is commonly practiced here. Drona Puspi Swaras, putting in nose just 4 to 5 drops in each nostril, and always also 1 to 2 drops in eyes. It mitigates, it subsides the effect of snake poison. It is commonly practiced in India. This is an ancient way of curing that. This is the antidote, what you call. Nowadays, people are, if any sometimes snake bites, people go to the hospital, they give antivenom. So this is also a type of natural antivenom, Dronapuspi. So this is what we call gumma or Dronapuspi. The extract of the juices of this, putting in nose and eyes, it works as a antidote for the snake poison. Similarly, there is a one more important that Nasyam variety, that is the Ardraxorus, the juice of ginger. This is very thick. It irritates very much. But the effect we have noticed in the ovulation, when the egg is not ovulating nicely, in that condition, the process it improve the induction system. This on the 3rd, 4th, 13th, 14th, 12th, 13th day of the menstrual cycle. So if the induction or that ovulation is not having properly, in that condition, in a modern day also they give some medicine, what you called there is a medicine which stimulate the ovulation, and ovulation happened. Similarly, in ancient days, the Ardraxorus is used similar way. They putting the two drops in nose. It irritates, but it works like a hormone medicine, which is giving for ovulation. Similarly, that Ardraxorus works as a ovulation medicine. So on the 12th, 13th day of menstrual cycle, you can put on nose, and it do in that ovulation. It helps in ovulation. So, but make sure this is very much irritating, and you have to do all these procedures under supervision of an expert Ayurvedic physician. So similarly, and one more thing, what you called Nasyam, the plain salt water. Salt means the Sandava Lavana, natural salt. So Sandava Lavana mixing in that water, plain drinking water, mixing in water, filter it properly, and that water used for hiccup condition. The people's having hiccup problem. Sometimes it takes a long time to subside this hiccups, and this is sometimes it is severe. It gives irritates a patient badly. So in that condition, you can use simple salt water Nasyam. So in that condition, what you have to do, just mixing Sandava Lavana in water, filter it, and putting 4 drops in each nostril, and just resting for 5 to 10 minutes. That hiccups will be down in further 10 to 15 minutes. Or you can repeat this process, the salt water Nasyam, you can repeat after 1 hour. If it is although it is down, it downs the hiccups, then you can repeat this process after 1 hour, and maximum dose is 4 drops. It irritates as well as it's Tikshna variety sometimes. So this is the simple salt water Nasyam. One more variety is what you call the Durva Soras. Durva is very much useful medicine here in India, as well as Durva always good for bleeding disorders. So similarly, people takes medicine for bleeding, that hemorrhage condition. People takes medicine orally or IV. Here in Ayurveda, they have explained medicines orally, that externally, and through nasal also. So that Durva Suras is always helpful in bleeding disorders. This bleeding may be from nose, bleeding may be from any part of body. It helps very much coagulant action. So it enhances the coagulant action and helps in Rakta Srava Rodha. It helps in stopping bleeding, excessive bleeding. And one more thing, you might be knowing, you should know that one more medicine, that is, there is a very much there is a process, what you call the Pumsvan process. Pumsvan process is a part of Garbhadhana Sanskaram. So part of Garbhadhana Sanskar process. one process is Punsan process. This is usually done during within 2 months of pregnancy. The main action of this Punsan process is to avoid abortion. You might be knowing that modern science also tells that there up to 3 months of pregnancy there is a huge chances of abortion. So this thing always, all that Ayurveda Acharya knows nicely. So they put one karma is Punswana karma. They told that you have to do this Punswana karma before finishing the second month, or after 1 month before finishing second month. In that you can adjust accordingly, but you have to do. The purpose of that Punswana karma is Strikaran, and this procedure to avoid abortion, to get stabilize the fetus in the uterus, to avoid all these problems, you have to use the Vatvraksha leaf extract, and that extract is only administered through nose. So that is called Vatvraksha Nasya karma. Vatvraksha Surasa Nasya karma. So you can imagine the action here. If you think that only Nasya karma works here, no, this is not correct. You can understand that our Acharya has told what leaf extract giving through nose, through Nasya karma, is it stabilizes the fetus. It avoids the abortion in first 3 months of pregnancy. So this is the area of working of Nasya karma. You can imagine. So similarly, this is the second variety. Third variety is the Pradhamna Nasya. Pradhamna Nasya is the churn powder, the super fine powder of any particular drug. Similarly, that I can tell that Vacha is a medicine. Vacha Churna Nasyam. It is helpful in Vata Kaphaja. The patient is having Vata Kaphaja Jwar and also having severe headache. Patient is having Jwar and headache. In that condition, for headache purpose, you have to give that Vacha Churna Nasya. Vacha super fine powder, that powder Nasya, and it helps immediately within 10 to 15 minutes. It helps very nicely. But this may be the Vata Kaphaja headache, Vata Kaphaja fever and Vata Kaphaja headache. So other one is Laghu Sooth Sekhar Ras. There is a medicine what you call Laghu Sooth Sekhar or Sooth Sekhar drug. That is in tablet form or maybe in powder form. Just you take a pinch and put inside the nose, ask patient to inhale. That will go inside and it helps very much in acute headache, which is especially due to Vata Pitta Pradhana, is sometimes due to epilepsy. Yes, sometimes people due to epilepsy go faints. In that condition, there are some medicines like Arka. The Calotropis procera is a medicine. What you call Arka. Arc medicine is a very important. It comes under Opovis variety of drugs. It is little bit poisonous, not too much, but what you call like a little bit poisonous. So that the powder of the root of Arka, just you have to 1 pinch of Arka powder, put that fainted epilepsy person, just put inside the nose. It will go inside automatically with the inhalation, and it works immediately. Within 1 to 2 months, patient will get up. It helps in case of murcha due to any reason. It helps in due to that, especially we have used in apasumara epilepsy conditions. It works immediately. So that Arka Churna Nasyam helps very nicely. So, and one more thing is, I have read in that Yoga Ratnakara book, they have always told that simple water Nasya during Brahmurat, in Brahmurat, it helps in frozen shoulder. I don't know how without medicine or only simple water works. Yes, but they have mentioned in book. So Brahmurat means early morning, 4 o'clock. Empty stomach, nothing you have to do. You have to take proper sleep and waking up in early morning, 4 o'clock, and taking, first of all, you have to take water nasya, plain water nasya. It helps in frozen shoulder, and this is mentioned in Yoga Ratnakara book. Similarly, fourth variety, this is a dhom nasya, very much important. So they have told that there are so many conditions where you have to use this dhum nasya. Dhum nasya, that using smoke for nasya purpose, inhaling through nose, helps in various fainting disorders like murcha, in various yes, it also useful after vamana procedure to stop vomiting. This helps. It goes inside the brain. It works on the vomiting center. What you can, this may be the theory, but practically we are seeing that this is the smoke of the particular medicine, particular oil. It, if inhaling through nose, it goes inside and it stops bleeding, further vomiting, not bleeding, that vomiting. And this is a mandatory procedure you have to do after Vamana karma. So this is the mandatory to stop further vomiting. Similarly, there is a medicine what you call Haridra. Haridra dhoom, Haridra smoke, useful in various headache disorder, various other disorder. Similarly, that Trikatu, Sunthi, Marich, Pipli. Trikatu smoke that helps in various allergic rhinitis disorder, various severe that chronic cold, in chronic rhinitis condition, that the smoke of Trikatu helps very much. So this just what you have to burn that medicine, the smoke you have to inhale. So this is the inhaling. So this is what you call dhomanasya. Similarly, there is a combination what you call that you just take some varieties of medicine like Haridra, Sunthi, Marich, and mix it with Gograt, original Gograt, and making that paste, and you have to make a varti using cotton swab and make it varti, and now you have to burn that varti, and the smoke you have to inhale. It helps very much in case of trigeminal neuralgia. It works in very much in Vata Kapha Pradhana disorder. It helps very much in Ardhaveda, migraine conditions. So selection of medicine also depends on indication. If patient is having, so there, one more thing I want to tell you, that medicines can be selected according to the condition. One thing. And the procedure, the way of form of medicines, it may be the powder form, swaras, that liquid form, it may be that smoke form, it may be the oil or gharat based. So the way of also you have to select, medicine also you have to select, and disease also you have to select. So this is nowadays commonly practiced, but this is not a simple process. You can use every time. In my practice, we are using in every patient. We are using in every patient the Nasyam procedures, and this is the we are noticing different results. So today we have discussed about the Nasyam procedures, its varieties, its effect, its type of medicines used, and indications we have experienced in our practice, and there are many other things people are doing. So thanks for this that this is opportunity, and hopefully this will be help you a lot in your practice, and thank you. Namaskar.